really important to talk about side effects with CML. Obviously, we're confident now that the majority of people have very effective treatment. So we're more and more conscious that side effects are an area of CML treatment where we really need to focus, because, as you know, the majority of patients with CML will need to stay on their treatment lifelong. So that's a long period of time to be taking these tablets, and we really want to make that as easy as possible. So I've sort of thought through probably the 5 commonest side effects that we come across in the clinic, and we can talk a bit in general terms, and then we can talk about each of them in more detail. But I'd say the commonest things people describe to me are a fatigue and a sort of a brain fog. Fatigue is a commonly used word, isn't it? And we all feel tired day to day, but sometimes the fatigue with CML and treatment is just this bone weariness where you just cannot move, you just cannot work. It can be really quite debilitating at times. And the brain fog, also quite frustrating. Short-term memory might not be quite what you're used to. Concentration to get through a task, motivation, they can all get a bit fuzzy. And that can obviously then have knock-on effects on trying to work, trying to run your household, and so on. So fatigue and brain fog probably come up the most often, I would say. In the very early stages, I think gut-type side effects, so nausea, actual sickness not so often, but sometimes, and diarrhoea, so the sort of abdo side of things, which we can talk about. Also, shortness of breath is something that we need to talk about because there's a particular side effect called a pleural effusion, which is fluid around the lung, which I think would be good to talk to in a little bit more detail. Skin rashes, again, quite common in the early days, and we've got some tips we can mention about that. And lastly, muscle cramps or bone pains, which can be relatively minor or they can be more significant, and that depends a little bit what your line of work is. For example, if your job involves very fine tasks with your hands and you're getting muscle cramps, that can be problematic. And muscle cramps can also affect your sleep, and that can also then have knock-on effects to the fatigue. So a lot of these side effects can interconnect a little bit, and if they're adding up to issues where you're finding it harder to just carry out your day-to-day tasks as you would like to, it can all add up over time to be something quite significant. So that's something that we'd really like to help with in your consultations in the clinics. So in terms of trying to predict what side effects you're going to get, that's, to be honest, really super hard. And what we can tell you to start with is that most patients will get something, but generally the side effects do ease off over time, generally within the first few months. But it's really important not to be too brave, not to struggle on in the face of side effects, because often there's an enormous amount we can do to help, and that doesn't necessarily mean we're just going to ladle out more tablets. So I think the first approach to side effects is to acknowledge them and say, actually, yes, this is how I'm feeling, and even if you don't necessarily need anybody to do anything about it, I think it's really helpful to acknowledge it, work out how it's affecting you. And then when you're going to bring that information to your healthcare team, it's really helpful for us if you've done a little bit of an assessment. Perhaps when did this start? If it is bone or joint pains, for example, is that something you'd had before your tyrosine kinase inhibitor drug, but now it's worse, or is it something brand new? Can you have a think about when it comes on, what might make it worse, what might make it better? Everybody's different with side effects, but it's really helpful for us, even if you can jot it down a little bit, and you almost keep a little bit of a diary, because we can then see when your side effects are most problematic, which might give us some clues as to how best to help with them. And it's also an idea of perhaps how serious they feel. You can almost give it a number, 1 to 10. And then as time goes by and the weeks and months go by, hopefully you can see that things are improving and you've got that sort of record to look back on. And it can really help us if we are changing your medication to compare one treatment with another. But it's so important to talk about side effects, because I think some patients have said, well, I don't want to complain. I don't want to just come to clinic and moan. And I always try and say this isn't moaning, this is just you telling us how it is, and that's half the point of the consultation. You know, as doctors, it's quite easy for us to focus on the results, but we know from talking to you and questionnaires and so on that it's quality of life that's super important to you. So very important that we talk through how your side effects are and how they're affecting you. And don't worry that we're suddenly going to switch your treatment or stop your treatment, or that your treatment might not be as effective if you talk about side effects, because it's our job to tread that balance. And any changes to your treatment will be done in conversation with you. It's a partnership. So if we have the facts, we can help, and then we can work out together the best way forward from there. So if we talk about some of the side effects individually, with some of the experience that we've gained in the clinics, starting off with fatigue and the brain fog side of things. Fatigue often has lots of factors contributing to it. Some will be CML related, maybe some won't. I think the first thing is that we do just screen your blood for easily fixable other causes, things like checking your thyroid function, perhaps your vitamin B12 or your vitamin D levels, checking you're not anemic, or if you just have a mild anemia, that's quite common with CML treatment, that it's at a manageable level. So first of all, looking at the sort of medical things that we can, there's some quick wins there sometimes by just supplementing them. Iron levels is another thing that we should look at and make sure that they're optimal. But then it may come down to how your lifestyle can work for you, and trying to make some adaptations that you feel acceptable that will just help you get through the day, through the week. And in a working environment, we can often help in terms of contacting employers for them to make reasonable adjustments for you. So, for example, I've had a lorry driver who realised that his fatigue very much came on later in the day. So we just arranged that all his driving was basically organised for the mornings. And that made his whole working day a lot more manageable. Or shift patterns. If we're working a lot of nights, and that really is quite tricky, managing fatigue, we can perhaps suggest to your employer that they may be able to give you more day shifts. So we can help a little bit with your workplace. Most workplaces we find are very understanding, and of course you may not want to tell your employer, you may want to just keep this separate, but just figuring out how working patterns can make your life better, whether that's working from home once or twice a week so you're avoiding the commute, taking more breaks, having a more flexible working pattern. It's common sense, but sometimes I find people just push themselves quite relentlessly if they're trying to juggle everything, and they forget that they are a patient that sometimes needs to give themselves a break and be a bit kinder to themselves and say, right, I need time out here. And the family juggle, or the running a household juggle can be just as challenging. And now's the time. I think when people are first diagnosed, friends and family are very keen, what can I do to help? They're all very concerned. And then quite quickly, they can almost forget, because most people with CML kind of look okay and everybody almost forgets about it. But it's never forget that people have offered that help and they like to help. And now's the time to say, yes, actually, if you can pick the kids up that day, if you can just do a shop, or just say yes to offers of help and work out how they can figure in to help you. There's no magic answers sometimes for fatigue and brain fog. It's trying to prioritise your sleep, your rest, and maybe working a little differently. You might need to write more things down. You might need some phone reminders. Phone reminders, obviously we're going to say taking your tablets is the most important thing you need to remember. So phone reminders can be really handy for that. So these are the sort of adjustments that might help with fatigue and brain fog. And on the same sort of theme of quality of sleep, perhaps thinking about cramps and issues that can upset your sleep. Muscle cramps are really common, particularly with imatinib, but with all the drugs we do see them. And we use quite a lot of calcium and vitamin D supplements to try and help with this. Even if your calcium levels are normal and we measure them, or your vitamin D levels are normal, just having that little bit extra we often find can help. So that's useful. Some people like to take magnesium as well. That can be useful, but it can cause a bit of diarrhoea if you take it by tablets. So there are also magnesium sprays that you can buy that some people find really helpful for sort of restless legs or muscle cramps in the legs. Or quinine or tonic water containing quinine can also help with the cramps. But the other advice I've had from patients is exercise, and they found not anything too strenuous necessarily, but either walking or doing something in the gym or riding their bike, that if they did that within their limits, that things they felt comfortable with, that also helped with the cramps, but also with well-being, self-esteem, just generally helpful. So that isn't going to work for everybody, but it's something to think about. But if you're doing your exercise and you're getting breathless, what do you need to do then? So you do need to contact us and have a little think about that. Again, breathlessness can have lots of different reasons, and it may be anemia related to your treatment. It may be that you've just got a little bit out of condition because you've not been so well for a while. But one very important side effect we need to just look out for with breathlessness is what we call a pleural effusion. So this is where some fluid collects around the outside of your lung and just pushes the lung tissue down a little bit. So it makes it harder to take a deep breath, and you'd notice breathlessness to begin with, perhaps just when you're walking up a hill or upstairs, but it becomes persistent. And it's very simple to diagnose. We can listen to your chest in clinic with a stethoscope, but we'll just do a chest x-ray. If we have any doubt at all, you have a chest x-ray and it'll show the fluid very easily. And then it's generally quite simple to fix, particularly if we pick it up quite early just by interrupting your drug. Sometimes we can give some extra medication to help, but we can sort it out relatively easily. But it's an important thing not to put up with and ignore, because we should be doing an x-ray and diagnosing that for you. And then the gastrointestinal symptoms are very common again, and particularly I would say at the very start, particularly with imatinib and bosutinib, perhaps more than the others. And the key is to predict it a little bit. So particularly with bosutinib, we know that can cause diarrhoea at the beginning. So you should go home clutching your packet of loperamide, or Imodium is the colloquial name for it. So it's a traveller's diarrhoea remedy, but it actually works really well for diarrhoea associated with tyrosine kinase inhibitor drugs. So make sure you've got that and that you use it. Don't be afraid to use it. It works really well for a lot of people. And some people just stay on one loperamide a day or every other day when they're going through their treatment longer term, and that's fine. Nausea can be a little bit harder sometimes to fix. For imatinib, I find it's really important to take your imatinib after food and relatively substantial food. So just a slice of toast at breakfast might not quite be enough. So take it after your, a mainish meal. And you might want to play around with that. You might find that after lunch is better. You might find after your evening meal is better. But that's the thing that can really help with imatinib. Some people try splitting the dose. So your standard imatinib dose is 400 milligrams in one tablet or capsule, but it does also come in 100 milligram strength. So some people try splitting it, 200 in the morning, 200 in the evening. That can sometimes help. We try not to treat side effects with more tablets unless we can help it, but sometimes just having a short course of an anti-sickness tablet alongside can just break the cycle, help you feel more comfortable and just get you through that early stage. And it's trying to eat little and often and drink enough, because either being dehydrated or having really empty stomach will make nausea worse. So they're the sort of initial tips and hints. And then the last thing we were going to talk about in this section is skin rash. And this is very different for everybody. Some people just feel their skin's uncomfortable, and it might feel a bit bumpy if they run their hand over their skin and you can't actually see anything. But that's not uncommon with these drugs. So it might be a feeling more than just something that you can actually see, or you might find that you've really got quite a florid skin rash. Or sometimes you can get almost like little pussy spots around the hair follicles, so in men around their sort of chest hair, and we call that folliculitis. That's quite common with bosutinib, but we can see it across the board. And some people find the skin is more sensitive to the sun when they're on these medications. So Again, skin rash is quite common. There's an awful lot we can do to help with skin rashes in terms of some just very gentle steroid creams or sometimes slightly stronger steroid creams, but also, again, sort of common sense, using sunblock, avoiding heavily perfumed skin products, using just simple moisturisers, making sure your skin's in as good shape as you can. But I'd sort of say, particularly for rashes, really, don't wait. That would be something that, you know, we can get. Again, it's often better that we get on top of it sooner rather than later, and then we can get some treatment in place to help you feel more comfortable. So in terms of what you do, if you think you're experiencing side effects, as we said, you sort of assess them, work out what you're feeling, and then work out how urgent it is really to contact us. So you should have a sort of emergency contact for your team, but you've probably also got a phone number for your clinical nurse specialists. That's more of a Monday to Friday 9 to 5 kind of thing. Or you may feel it may just wait for your next clinic appointment if that's not too far away. But if in doubt, contact us is the key thing. And if you do feel unwell, then use that emergency number. It's there for a reason, and somebody experienced will listen to how you're feeling and help you sort of triage how urgently it needs to be dealt with. Most CML side effects that can be, you know, wait till the next day kind of thing, but not always. And if in doubt, just ring. We always want to just be involved. We might end up saying, actually, I think that might not be a side effect. It might be something separate, and we're not perhaps the best people to advise you about that. So we might signpost you to your GP. But even so, we like to be in the loop. We like to know not just about your CML or side effects. It's also important that we know about your other health conditions and if they're changing, or if perhaps you start new medicines for another reason. That's important that we know about. So we're really nosy, but equally clinic time sometimes can be quite pressured, and we might not remember always to ask you about all the other aspects of your health. So use your clinic time to inform us, to tell us about side effects and any other issues sort of more broadly. As I say, there's various strategies and advice that we can give you. And then we also have to think, what are we going to do about your actual medication? Do we need to make any alteration? And sometimes we do. Sometimes we need to give you a bit of a break, a little bit of a holiday from the drug to just let everything settle down. And we've done this time and time again for patients. And we know how to do this in a safe way that means that your CML is very unlikely to go out of control. So we'll always balance that with how well your CML is doing, how confident we are in your response to your treatment, and openly with you discuss the best thing to do. But often a short break is what's needed, or alternatively a reduction in your dose. And we've got more and more data now that it's safe to dose reduce. All our drugs, really. We have more and more experience and some published data that lower doses can be just as effective. And what's important with tyrosine kinase inhibitors is that you are able to take them fairly continuously. So we need to find a dose that you find okay to tolerate day in, day out, without gaps where you just feel you just can't take it. So sometimes reducing your dose a little bit, but to a point where you can take your treatment then every day more comfortably is the best way forward. So yes, sometimes we might need to jiggle about a bit with the treatment that you're on. Sometimes we might need to switch you to something else. And if your side effects are significant, then we're lucky now we have 6 different drugs that we can think about using. I think it's important we don't chop and change too quickly between them, but it depends a little bit on what side effect you're having and how serious it is. But we do have options, so again, don't despair with side effects that you're just going to be stuck like this for a long time. We may well be able to switch you to something that you tolerate more easily. And sometimes we may switch for something very big and obvious, like a pleural effusion. Perhaps it's come back a couple of times. We think, no, we need to switch. Or perhaps we've picked something up on your blood tests. Perhaps your liver tests have gone off a little bit, and we think that the drug you're on isn't the right one, and we need to switch you. And those decisions are perhaps more straightforward. But sometimes it can just be that all the side effects that are just dragging down your quality of life, whether that's fatigue or poor sleep or the muscle cramps, maybe it's just when you add all those up, your quality of life is really not what it needs to be. And sometimes we will switch just for that reason. And I say just, I don't really mean just. Individually, perhaps each of those side effects you might think wouldn't be so important. But when you add them all together, if they're affecting your quality of life and your ability to work and enjoy your home life, then they're important. And I sometimes do switch people's therapy for those side effects, just as much as I might switch for the ones that perhaps might be perceived as more serious.